Hello, everyone. Thanks for joining us today. Good afternoon and good morning-ish to our partners in Hawaii. I am Twin Tran, AAPCHO's Training and Technical Assistance Director. On behalf of AAPCHO, I welcome you to today's webinar on social determinants of health characteristics for emerging Asian Americans, Native Hawaiian, and Pacific Islander populations by state. A little bit about AAPCHO. AAPCHO is a national association of 35 community health organizations dedicated to promoting advocacy, collaboration, and leadership that improves the health status and access of AA&NHPIs. We are also a Bureau of Primary Health Care Training and Technical Assistance National Cooperative Agreement holder, funded to provide PTA that is data-driven, cutting edge, and focused on quality and operational improvement to support health centers, lookalikes, and newly funded HRSA awardees in caring for Asian Americans, Native Hawaiians, and other Pacific Islanders. So before we begin our session today, just to give you a background, Asian Americans, Native Hawaiians, and Pacific Islanders are among the fastest growing racial ethnic groups in the U.S. and expected to triple in size from 2005 to 2050. AA&NHPIs are highly diverse in their culture, language, and health needs, representing more than 50 ethnic groups and over 100 languages. In this webinar, our panelists will set the context for our focus on social determinants of health data analysis and provide a portrait based on publicly available data sets on the social determinants of health characteristics. Today's agenda will include presentation followed by a Q&A session. Before we begin, I want to review a few housekeeping items with you. Here we are looking at an example of the GoToWebinar attendee interface, which is made up of two parts, the viewer window and the control panel window. The viewer window allows you to see everything the presenter is sharing on the screen, and the control panel allows you to participate in the webinar. Clicking the orange arrow button, you can hide or show your control panel window. Please note that all attendees are in listen-only mode, and you may submit questions and comments during the presentation portion by typing them into the question fields of your control panel. We will be reviewing questions as they come in, but we will address them after the presentation portion of the webinar. Today's webinar is being recorded, and you will receive an email with a link to view the recording after the webinar. Our first panelist is Jen Lee. Jen is AAPCHO's Director of Community Services and Partnerships. She is the Director of AAPCHO's Bureau of Primary Health Care National Cooperative Agreement, providing technical assistance and training for AA&NHPI serving health centers nationally. The development of new health centers and AAPCHO CDC-funded diabetes prevention program. Prior to joining AAPCHO, she spent 14 years in a federally qualified community health center, Asian Health Services in Oakland, California, providing operational oversight of eligibility and enrollment, community outreach, translation, and medical interpreter certification and advocacy initiatives. And with that, I'll have Jen, you start.
Great. Thank you, Twin. Thank you so much, everyone, for joining us today, and really what is the first in a series of 3 learning sessions that AAPCHO is going to be hosting, focused really on the availability of data and the strategic approaches to identifying and monitoring the needs of underserved Asian American, Native Hawaiian, and Pacific Islander populations. As many of you know, health centers serving Asian Americans, Native Hawaiians, and Pacific Islanders frequently encounter limitations in available data on our populations at all the local, state, and national levels, creating unique challenges which seek us when seeking to illustrate the unique needs of our subpopulations for needs assessments, strategic planning, and/or expansion efforts. We know that many of you on the line use multiple data strategies ranging from community needs assessments to patient surveys and other partnership efforts to help tell your health center population's unique story. So we really want to encourage you to continue to participate and look out for our learning series that really intends to provide access to new tools and data resources that support the monitoring and identification of need for medically underserved AA and NHPI populations, and also to share successful health center strategies in the use of community needs assessments to support the expansion of your work and your efforts with Asian American, Native Hawaiian, and Pacific Islander populations. Following today's presentation, we'll have a little bit more information about our next upcoming learning session, and urge you to stay tuned. Thanks so much, and I'll turn it back to you, Twin.
Thank you, Jen, for setting that context for us for this kickoff webinar. So our next panelist is Vivian Lee, and Vivian works with the AAPCHO research team to provide statistical analysis support to a variety of AAPCHO programs. Prior to joining AAPCHO, Vivian worked as a teaching assistant for several statistics courses in the Department of Statistics, Purdue University. She also completed an internship under the WHO Global Influenza Program at the World Health Organization in Geneva, Switzerland. She is a SAS certified base programmer for SAS 9. Vivian received her bachelor's in mathematics with a concentration in statistics at St. Olaf College in Minnesota, and her master's in mathematical statistics at Purdue University. So before we have Vivian start, we have a poll that we're going to launch right now, and please, if you can help us by filling that out. Okay, and now. Okay, so thank you for participating in that brief poll. Vivian, are you ready?
Yep. All right, thank you, Twin, and thank you all for responding to that poll just now. So before we get into the data and the analysis, I'd like to talk about why it is important to understand the areas with the fastest growth rates for Asian Americans, Native Hawaiians, and Pacific Islanders, along with their social determinants of health characteristics. Asian Americans, Native Hawaiians, and Pacific Islanders are diverse in culture, language, and health needs, like Twin mentioned earlier, representing more than 50 ethnic groups and over 100 languages. According to the 2010 census, the Asian population alone grew faster than any other race group in the United States between 2000 and 2010. In addition, 1 in every 8 of foreign-born Asian Americans living in the United States are undocumented and are ineligible for Medicaid or participating in the ACA marketplace. So despite rapid growth, Asian Americans, Native Hawaiians, and Pacific Islanders face unique and significant social, emotional, and physical health burdens due to the deficit they experience related to social determinants of health, such as poverty, limited English proficiency, education, and health insurance coverage. So in this webinar, we will provide a portrait of the fastest growing Asian Americans, Native Hawaiians, and Pacific Islanders by state, with profiles of their social determinants of health characteristics. Understanding the areas with the fastest growth rates for Asian Americans, Native Hawaiians, and Pacific Islanders, along with their social barriers, can bring greater awareness of needed health and culturally and linguistically appropriate services, as well as promoting collaboration with states that are not historically known for growth in this population. And although it is also important to understand areas with largest concentrations of Asian Americans, Native Hawaiians, and Pacific Islanders, this is not the intent of this webinar. We wanted to look at the trend of the growth in order to inform future policies and strategies, instead of looking at known areas with large concentrations of Asian Americans, Native Hawaiians and Pacific Islanders, where efforts targeting these populations could already be in place. Next slide, please. So to identify the top 5 states with the fastest Asian American, Native Hawaiian, Pacific Islander growth, we used data from the 2000 and 2010 census. Because data were not available on a state level for Native Hawaiians, Pacific Islanders in the more recent American Community Survey 1-year data in 2015. Also, we identified the states by rates of growth instead of numeric growth. Then, for comparison of social determinants of health characteristics, we used the 2013 3-year estimates, although in some cases, data for Native Hawaiians and Pacific Islanders were not available by state. So the following presentation shares findings from a recent report on the fastest growing Asian American, Native Hawaiian, Pacific Islander populations by state and the profiles of their social determinants of health characteristics. This is intended as a primer and reference to Asian American, Native Hawaiian, Pacific Islander populations' growth trends and social needs to help further inform key stakeholders, including health centers and primary care associations, to consider or reevaluate their current access to care initiatives and local partnerships to support these emerging populations. So using the census data, we identified the top states with the fastest growing Asian American, Native Hawaiian, Pacific Islanders from 2000 to 2010 to be Nevada, Arizona, Arkansas, North Carolina, and North Dakota. With 114%, Nevada had the highest growth rates of Asian Americans, Native Hawaiians, and Pacific Islanders, which means the Asian American, Native Hawaiian, Pacific Islander population in Nevada more than doubled in size in the decade. And the sizes of Asian Americans, Native Hawaiians, and Pacific Islanders in Arkansas and North Dakota were not big, but they both experienced a growth rate of more than 80%. Next slide, please. Yeah. So this graph shows the same statistics as the previous table, but on a US map. So again, the top 5 states with the fastest growing Asian American, Native Hawaiian, Pacific Islanders are Nevada, Arizona, Arkansas, North Carolina, and North Dakota. Next slide, please. The next few slides show comparisons of some key social determinants of health characteristics between whites and Asian American, Native Hawaiian, and Pacific Islander populations in the 5 states just mentioned. So the social determinant of health characteristics data were from the 2013 American Community Survey 3-year estimates. But in some cases, data for Native Hawaiian and Pacific Islanders were not available by state. The comparison is between 3 racial groups: white alone versus Asian alone or mixed Asians versus Native Hawaiian and Pacific Islanders alone or mixed. So we compared 7 social determinants of health variables, and they are educational attainment, foreign-born, language spoken at home, and ability to speak English, employment status, health insurance coverage, poverty level, and household characteristics, which includes 3 aspects: average household size, percent with 1 or more occupants per room, and percent with no telephone services available. In the next few slides, we'll show you comparisons of these social determinants of health characteristics between the three populations. And if you see a star next to a number, it means the number is statistically significantly different compared to the white alone group at a significance level of 0.05, except for average household size, because there were not enough detailed data to perform statistical testing on this variable. Also, please note, although some of the social determinants of health measurements are statistically significantly different, practically the differences are very small. So Nevada was the state with the highest growth rate in Asian American, Native Hawaiian, Pacific Islander populations, which was again 114%. The total population of Asian American, Native Hawaiian, Pacific Islanders in 2013 was almost 300,000. Although Asian Americans in aggregate did not differ much from whites in attainment of high school diploma, employment status, health insurance coverage, and poverty rates, Asian Americans had significantly higher rates of foreign-born and limited English proficiency compared to whites. Native Hawaiian and Pacific Islanders, however, had a slightly higher uninsured rate and higher poverty rates. In comparison to whites, Asian Americans and Native Hawaiian Pacific Islanders both tended to have higher average household size as well as higher proportion of occupants per room in a household. Next slide, please. So with 94%, Arizona was the state with the second largest growth rate in Asian American, Native Hawaiian, and Pacific Islander populations. The total population of Asian American, Native Hawaiian, and Pacific Islanders in 2013 was over 275,000. And same as in Nevada, Asian Americans had higher rates of foreign-born and limited English proficiency. Native Hawaiian Pacific Islanders had a higher rate of foreign-born, but not higher than what was in Nevada. They also had higher rates of unemployment, uninsured rate, and poverty rate. In comparison to whites, Asian Americans and Native Hawaiian Pacific Islanders both tended to have higher average household size and higher proportion of occupants per room in a household. Next slide, please. So unfortunately, data were not available for Native Hawaiian Pacific Islanders in Arkansas. With 85%, Arkansas was the state that with the third highest growth rate in Asian American, Native Hawaiian, Pacific Islander populations. The total population of Asian American, not including Native Hawaiian Pacific Islander in 2013 was nearly 50,000. Same as the other states, Asian Americans had significantly higher rates of foreign-born and limited English proficiency compared to whites. Asian Americans also tended to have higher average household size and higher proportion of occupants per room in the household. And also in Arkansas, with higher rate of no telephone services available in the household. North Carolina was the state with the fourth highest growth rate, which was 84%. Similar to Arizona, the total population of Asian Americans in 2013 was also over 275,000. Data again was not available for Native Hawaiian Pacific Islanders in North Carolina. Same as in other states, Asian Americans had higher rates of foreign-born and limited English proficiency. Asian Americans also tended to have slightly higher rates of high school diploma attainment, which is different than in the other states, what we've seen so far. Asian Americans also had higher average household size as well as higher proportion of occupants per room in the household. So North Dakota, unfortunately, as the fifth fastest growing state in Asian American, Native Hawaiian, Pacific Islander populations, growing from 5,000 in the year 2000 to 10,000 in the year 2010. North Dakota did not have social determinants of health data available for Asian Americans or Native Hawaiian Pacific Islanders in the American Community Survey. So given the above results, here are the conclusions and our recommendations. Overall, in these 5 states, compared to whites, Asian Americans were more likely to be foreign-born and have limited English proficiency. Native Hawaiians were more likely to be uninsured and in poverty. Both Asian Americans and Native Hawaiian Pacific Islanders tended to have higher average household size as well as higher proportion of occupants per room in a household compared to whites. Therefore, although Asian Americans and Native Hawaiian Pacific Islanders face some similar social barriers, they also do face barriers that are unique to their own racial group. I also wanted to point out that we make these comparisons to better understand the barriers that Asian American, Native Hawaiian, Pacific Islanders are facing so that more targeted efforts can be made and not to add on to some of the existing stigma that Asian American, Native Hawaiian, Pacific Islander populations are already facing, because these results are only what the available data tell us. And although these aggregated rates may not demonstrate disparities in certain social characteristics, it is important to note that rates that are desegregated have shown higher rates. For example, studies studies that analyze Asian American desegregated group on a national level have found higher rates of social determinants of health barriers, such as education, compared to other racial groups. Actually, 6 out of the top 10 highest groups with less than high school education are Asian American groups. Although many publications convey that Black or Hispanic groups face the highest inequalities, analysis using desegregated Asian ethnicity data clearly show otherwise. So for recommendations, overall our analysis and results showed the need and importance of collecting more detailed data at state and or smaller geographic levels, as well as standardizing analysis of race and ethnicity on a desegregated level in order to illustrate and effectively respond to the social determinants and health disparities of Asian American, Native Hawaiian, and Pacific Islanders. Next slide, please. So for Asian American and Native Hawaiian Pacific Islanders, continued assessment of language and culture as social determinants and the tracking of enabling services will be necessary in order to demonstrate the impact of comprehensive, culturally and linguistically responsive services on patient outcomes. Within the health center setting, we recommend using a standardized approach, validated and vetted for health center patients' populations. For the tools, please go to nac.org/prepare. Next slide, please. And here are the references for this webinar.
All right, thank you so much for that informative talk on the recent report, Vivian. So before we get to the questions and answer portion of our webinar, we have another poll for everyone on the line. So go ahead and launch that. Okay. Okay, thank you so much for your participation in our poll. Next slide, please. Okay, so thank you to Jen and Vivian. We are now on the question and answer portion of our webinar. As mentioned at the beginning of the webinar, we will start by answering questions submitted to us during the presentation. And if you have a question that you haven't submitted, please do so now in the question function of your GoToWebinar screen. So the first question is for Vivian. You mentioned that this was an analysis of growth states, but do you have a sense of what are the states that have the largest AA&NHPI population?
Yeah, sure. So according to the 2010 census, for Native Hawaiian Pacific Islanders, actually over half of them live in just two states, Hawaii and California. So in addition to Hawaii and California, the states with the next largest Native Hawaiian Pacific Islander populations in 2010 were Washington, Texas, Florida, Utah, New York, Nevada, Oregon, and Arizona. So together, these 10 states actually represented over 3/4 of the entire Native Hawaiian Pacific Islander population in the United States. And then the 10 states with the largest Asian population in 2010 were California, New York, Texas, New Jersey, Hawaii, Illinois, Washington, Florida, Virginia, and Pennsylvania. Together, these 10 states represented nearly 3/4 of the entire Asian population in the United States. Yeah.
All right, thank you. And I know we have folks from those states registered on our webinar as well. So I hope you guys are finding this this information and data really helpful and useful for your work. The second question is, what are the states that experience the highest numeric growth in terms of Asian Americans, Native Hawaiians, and Pacific Islanders?
So in terms of the numeric growth, California and Texas had the largest numeric growth of Asians. The population grew by 5.4 million over the decade. California had the largest numeric growth of people reporting Asian race, increasing from 4.2 million in 2000 to 5.6 million in the year 2010. Texas had the next largest numeric growth, increasing from almost 700,000 in 2000 to 1.1 million in 2010. So these are the states that already have sizable Asian American, Native Hawaiian, Pacific Islander populations and have experiences providing services to these populations. So there may be lessons learned and collaboration opportunities between these states and the states that are just now experiencing growth in this population.
Thank you, Vivian. And for folks in California and Texas, we'll be looking to you in terms of learning about your experience in working with AA&NHPIs. The next question that came in was, you mentioned looking and comparing at 7 SDH variables, and we're just pulled up the variables for folks on the line. Were there additional social determinants of health variables available in the data set?
I think household income were also available, but not by race. These seven variables were the ones that were available by race.
Okay, thank you. And then given the limitations that you noted from the data set, what can health centers do to gain a better understanding of AA&NHPI needs?
Yeah, I think first, as I mentioned, to collect disaggregated data, because again, Asian American, Native Hawaiian, Pacific Islanders include over 50 racial groups and over 100 languages that each face unique barriers and health needs. And also tracking of enabling services is also necessary in order to demonstrate the impact on patient outcomes. For health centers, Prepare is really a great tool. It's nationally standardized, validated, and also available across different EHR platforms. And free.
Yes, great. Thank you so much for that, Vivian. So we just pulled up the slide deck here with the link where you can access sort of both tools, what Vivian had just shared, that is better assessing what the social risks are at the health center level, and then better tracking of the interventions that the health centers are providing to address those risks. So that slide is up with a link for you. And then the final question that we have is, what are available resources to health centers in their data collection efforts? And Jen, you can speak to this, I'm sure, question as well.
Sure, thanks, Twin. Yeah, I think in addition to what Vivian recommended, I mean, certainly we would encourage you to look at the enabling services protocol that AAPCHO's developed. It really helps to map out the specific services that your subpopulations that you may be working with are really in dire need of and critical to providing service. I would just add, I think that one thing that AAPCHO has been focused on is really honing in, and again, our focus, we look at federally qualified health centers and the trends that and innovations that they're setting, but AAPCHO also provides, for those of you who may not be aware, sort of an annual fact sheet, really looking at health centers that do focus and have a substantial population of Asian Americans, Native Hawaiians, and Pacific Islanders. And we use, sort of working with Vivian's team, our analysis of the Uniform Data System data that health centers are required to report annually, and try to surmise that findings and trends of what that patient profile really looks like for those who are accessing care in the health center setting. And so you keep an eye out for that report coming from us, and that'll be looking at last year's data, the 2016 data set. I also wanted to just offer another product that we're working on to keep an eye out on, is a more in-depth profile of looking at Asian American, Native Hawaiian, and Pacific Islander populations in the public housing setting, and those accessing care through health center partnerships that partner with public housing entities. We understand that that's also a substantial subpopulation group that we want to learn more about, and we'll be collaborating with Community Partners for Sustainability on that profile. So just a couple additional resources that AAPCHO will be putting out, so continue to look at our website for more information.
Okay, thank you, Jen. So at this time, we don't have any more questions that are coming in, but in case you need some time to come up with more questions, we have a little bit of time. So I wanted to share with you, as Jen mentioned earlier, this webinar is really a kickoff to our learning series on supporting health center needs assessment. So we encourage you to continue learning alongside us and others. The next, sort of the second webinar in our series is going to be coming up on Friday, January 19th, and that is really a training on folks who are not familiar with Community Commons and all the data sets that they have available at your fingertips. So they will be providing a training on how to use their tool and resources on the next upcoming series, on the next upcoming webinar we have in this series. So there's a registration link on the slide deck, and we'll be sure to send the link specifically out to you as well. And then, so in the meantime, I'm just going to look to see if there's any question that came in. Okay. So at this moment, seeing that there are no more questions that came in, I would like to thank our panelists, Jen Lee and Vivian Lee, for giving us a really great webinar and some great resources today. Our email contact is listed in this slide. For any questions or you want more information or details about our upcoming resources and what AAPCHO has to support you in getting data to better serve your patient population, please don't hesitate to contact us. And with that, please enjoy the rest of your afternoon and late morning-ish. So, and also help us by completing our eval questionnaire, which is going to pop up right after we end this. So thank you everyone for your time, and we look forward to speaking with you on January 19th. Thank you. Bye-bye.